What is the process of DNA analysis for CFTR mutations? Imagine trying to find a tiny typo in a massive instruction manual. That's similar to how scientists look for mutations in the CFTR gene, which can cause cystic fibrosis. The process starts with collecting a sample of blood or saliva from the person. From this sample, laboratories extract DNA, which is the genetic blueprint stored inside our cells. This DNA then becomes the focus of testing to identify any changes or mutations in the CFTR gene, located on chromosome 7. Most initial tests use a method called mutation panel testing. Think of this as a quick scan for the most common typos that cause cystic fibrosis. The panel screens for about 23 of the most frequent mutations, including the well-known F508del mutation, which accounts for a large number of cases worldwide. This approach is efficient and cost-effective, helping to identify whether someone carries these common mutations or has cystic fibrosis. To do this, labs often use techniques like allele-specific multiplex real-time polymerase chain reaction, or PCR. This method amplifies specific parts of the DNA to check if the normal or mutated version is present. It can tell if one or both copies of the gene carry mutations, which is important for understanding whether someone is a carrier or affected. Sometimes, high-resolution melting analysis is used alongside PCR to confirm results and even pinpoint the exact mutation. If initial testing doesn't find the mutation, or if a more detailed picture is needed, full gene sequencing is performed. This involves reading every part of the CFTR gene, including exons, introns, and regulatory regions. Sequencing helps detect rare or new mutations that aren't covered by the standard panel. Labs also perform deletion and duplication testing to find larger genetic changes, like missing or extra pieces of DNA, which sequencing might miss. Sometimes, additional targeted tests are done based on initial findings. For example, if a mutation like R117H is found, further testing for nearby genetic variations, such as the 5T allele, can clarify its significance. Testing can also be tailored for family members if a mutation has been identified in a relative, helping to understand inheritance patterns. Once the testing is complete, genetic experts interpret the results. They classify variants as disease-causing, benign, or uncertain. This interpretation is crucial for accurate diagnosis and guiding treatment. Genetic counseling is an essential part of this process, helping individuals and families understand what the results mean for their health, reproductive choices, and future planning. The information gained from DNA analysis supports diagnosing cystic fibrosis, screening carriers in the population, and following up on newborn screening results. It also helps personalize treatment plans, especially with new therapies that target specific types of CFTR mutations. For example, some medications work better for certain mutation classes, making genetic testing a key step in modern cystic fibrosis care. In summary, DNA analysis for CFTR mutations involves collecting a sample, screening for common mutations with panels, performing detailed gene sequencing if needed, and interpreting these results with the help of specialists. This comprehensive approach ensures accurate diagnosis, informs family planning, and guides personalized treatment options. Always remember to consult healthcare professionals for advice tailored to individual situations, as each person's genetic makeup and health journey are unique.